IHL in action, protecting the wounded and sick. These are wounded civilians, some of the many caught in the middle of fighting in Sri Lanka in 2009. They were being evacuated from Putumatalan to Trincomalee on an ICRC-chartered Green Ocean ferry. In Trincomalee, healthcare workers, together with an ICRC medical team consisting of a surgeon, an anesthetist, and a nurse, await them in a hospital for immediate and much-needed treatment. Upon first glance, the situation appears straightforward. Fierce fighting has resulted in many people wounded, and there is a lack of properly functioning medical facilities. In coordination with the parties to the conflict, a humanitarian organization or the personnel of a state not involved in the conflict has deployed a hospital ship to evacuate the wounded to a safe place and arrange for their treatment in a fully equipped hospital. But what is happening behind the scenes? What's important to remember is that none of this would have been possible if the laws of war had not been respected. Let's break it down a bit by examining this real-life situation. In 2009 in Sri Lanka, there was an armed conflict ongoing. Recognizing its obligations to take all possible measures to collect conflict-affected civilians and wounded and sick combatants without adverse distinction, the Sri Lankan Navy established comprehensive evacuation measures in cooperation with the ICRC. The Navy deployed naval personnel and vessels with standby rescue and medical teams nearby seaside conflict-affected areas. Between the 10th of February and the 14th of April 2009, Sri Lankan naval ferries, chartered by the ICRC, safely evacuated more than 6,000 weapon-wounded or sick patients. These wounded and sick evacuees were able to receive appropriate treatment at adequately equipped hospitals staffed by competent health ministry and ICRC medical personnel and specialists. This is only one example of how the different elements of respect for international humanitarian law, IHL, come together to reduce human suffering during times of armed conflict. And what if I told you that during that same year, parties to the conflict complied with their obligations and allowed evacuations of the wounded and sick 31 times? With the ICRC acting as a neutral intermediary, thousands of civilians, wounded and sick patients, and vehicles were able to pass safely between front lines. Armed conflict takes a terrible toll on combatants and civilians, and there are many examples of disregard of the laws of war. But in the past years, we have documented respect for IHL regarding wounded and sick in Africa, the Middle East, Asia, and the Americas. These instances of respect for IHL also matter because they literally make the difference between life and death for people in the battlefield. When international humanitarian law is respected and its humanitarian spirit upheld, lives are saved and a level of dignity is preserved. To explore more examples of compliance with international humanitarian law and the difference it makes for people affected by armed conflict and violence, visit IHL in Action, Respect for the Law in the Battlefield.